Assalamu alaikum. Let's discuss about medical condition causing enuresis. What is enuresis? Enuresis, commonly known as bedwetting, refers to involuntary urination, especially at night in children who are old enough to have expected bladder control. It is in it like involuntary urination most commonly refers as nighttime bedwetting or nocturnal enuresis. There are some etiologies, there are some medical conditions causing enuresis. First, constipation. If the patient has infrequent, if the patient has infrequent or hard stool in copresis, if the patient has infrequent and hard stool and in encopresis. Encopresis, also known as fecal incontinence or swelling, is the repeated passing of stool bowel movement into inappropriate places like clothing. So infrequent hard stool encopresis. Finding is with or without palpable soft mass. Bladder dysfunction. Bladder dysfunction. This constipation and bladder dysfunction is clinical diagnosis. In bladder dysfunction, there is daytime incontinence, weak stream, urgency, straining, with or without recurrent UTI. And urinary tract infection, there may be dysuria, urgency, frequency, abdominal pain, and if you do the urine uh, culture, there is positive urine culture in UTI. CKD can cause daytime incontinence. Daytime incontinence can be done in CK, daytime incontinence can happen in CKD, also in bladder dysfunction. And in CKD, there is weight loss and fatigue. There may be hypertension, proteinuria, and hematuria. Diabetes mellitus, there is polyuria, polydipsia, polyphagia. There may be weight loss and fatigue. And if we do urine REME, we can see that there is glucosuria. That means presence of glucose in the urine. Diabetes insipidus, there is polyuria, polydipsia, low urine specific gravity, and in OSA, obstructive sleep apnea, there may be snoring and hyperactivity in attention, and adenotonsillar hypertrophy may happen. Okay, look at this question. The 7-year-old boy comes to the office with his parents due to bedwetting. He achieves daytime dryness at age 4, but he has never stayed dry, but he has never stayed dry overnight for more than 3 consecutive nights. His urinary stream is strong, okay, no dribbling, no straining urgency, there is no infection, okay. The boy is irritable and irritative, often interrupting his teacher and disrupting his classmates at school. The boy achieved nighttime dryness at age 5, height and weight 75%. Okay, tympanic membranes are clear, tonsils are symmetrically enlarged. Okay, tympanic membranes are clear, tonsils are symmetrically enlarged, very high health. So there is tonsillar enlargement. This point. So adenotonsillar hypertrophy (OSA), and the child is interrupting, inattentive, urinalysis and serum creatinine, so no kidney problem, no urinary infection, looks like OSA. So obtain nocturnal polysomnography. So this nocturnal enuresis, that is nighttime urinary incontinence uh, at more than age 5, and is a common in childhood condition, particularly in boys. Okay. In addition to waiting to the bed, the child is irritable and inattentive with tonsillar hypertrophy. So these finding concerning for OSA, as the patient causes as the underlying cause of his aneurysm. Aneurysm may reflect apnea effects on arousal response, effects on the bladder pressure, urinary hormone secretion, or difficulties awaking in response to full bladder. Instead of daytime somnolence seen in adult with OSA, uh, behavioral concerns like inattention, impulsivity, mood changes are common manifestation of sleep disturbance in children. OSA is also associated with increased blood pressure as seen here. The blood pressure is on 90 percentile, so it is higher, and there is poor growth, decreased nocturnal hormone secretion, and cardiovascular complication, core pulmonary. So evolution of the OSA is nocturnal polysomnography sleep study, and treatment is adenotonsillectomy, positive ARA pressure. So that is all about medical condition of aneurysm. Hope you enjoyed.